Hello and welcome to another episode of This Week in Hearing. I'm Brian Taylor. Our topic this week is the AirPod as a hearing aid substitute. And with us to discuss her group's research on this topic is Nicky Chong-White. Dr. Chong-White is a principal engineer and leads smart technology innovations at the National Acoustic Laboratories in Australia. Welcome to This Week in Hearing, Nicky. It's great to have you with us.
Yeah, thanks. And thank you for inviting me. It's great to have this chat today.
This is a really hot topic, and I think we have a lot of listeners who are anxious to hear what you and the NAL group have been up to. But before we dive into that topic, I thought it'd be a good idea if you could share a little bit about your background and what you've been doing at NAL for the last several years.
Yeah, so my background is in speech signal processing. I've been in this field for a while. Started off with more speech coding and mobile telecommunications. Worked in the US for a bit at AT&T Labs, but I've been at NAL for almost 20 years now. So it's a long while first starting off with speech enhancement, then moving into electrophysiology, and more recently developing a lot of apps and sort of mobile technologies to help in the connected health space. And certainly now with the AirPods Pro and them bringing out the new features, I was certainly interested to look at that as well.
Yeah, well, it's not often that we have an engineer on the broadcast and one that's so accomplished and is working on such innovative technology. So we're really happy that you could spend some time with us. I'm going to start with a really simple question because I get this in the field, and I know that there's confusion amongst consumers who watch our broadcast, and that is what AirPod models have the capability of providing amplification?
Okay, so for personalized amplification of the sounds around you so that they work more like hearables, you need the AirPods Pro. So they're the ones, have I got some here? You can't see that. but they're the ones with the short, stubby stems and the silicon tips that seal in your ear canal. And with those ones, they have the Headphone Accommodations feature and a transparency feature to hear the sounds around you. But if you also just want to provide amplification to streamed audio, then the regular AirPods 2 or 3 do have that feature as well.
Okay, that's good to know. You mentioned hearing enhancement, turning the AirPod Pro into basically a hearable. Can you tell us a little bit about those hearing enhancement features that are available on the AirPod Pro?
Yeah, so there's basically 3 main features that I see. So the Headphone Accommodations feature, this is one where you can maybe upload your audiogram or choose one of the preset profiles, and that applies a frequency-dependent gain to the audio signal, and that'll make those soft sounds more audible. It also does have compression as well. The other ones are Conversation Boost, and that uses directional microphones and some signal processing techniques, where it allows the user to focus on the person speaking in front of them while suppressing sounds from the side and behind. And then the last one is an ambient noise reduction feature, which uses digital signal processing techniques to reduce background noise.
That's good to know. Now, I know that the NAL group does, on YouTube, I've seen it, something called sound bites. Is that right?
Yes, that's right.
Yeah, and I know that maybe a year or so ago, you did a video, one of your Soundbites video, providing some details on how to set up the AirPods Pro to be an amplification device. So there'll be a link on the bottom of the screen for anybody that wants to know more details on how to go through the process of setting up the AirPod Pro to be an amplification device. My next question is about AirPods Pro. I think, at least here in the United States, over-the-counter hearing aids is a hot topic. Now, we know that the AirPods Pro is not an OTC hearing aid, but how does the AirPod Pro compare to them? What features or what, I guess my question would be relative to OTC devices. We'll start with the question, what types of hearing losses might benefit from setting up an AirPods Pro to be an amplification device?
Yeah, so definitely not, regulated medical devices. They are consumer audio devices. I see with some, nice to have hearing assistive features. So I think that the main target audience I see them as helping is people who have occasional hearing difficulties in specific situations. So, perhaps they have a mild loss, perhaps they don't even have a measurable loss, but do struggle in, for example, having a conversation in a noisy restaurant. So they will work well for that. You can put in like just a mild gain, use some of the, for example, conversation boost features. You might have them in for half an hour and then, they're in your pocket or your bag for the rest of the day. So yeah, those occasional use, maybe a mild gain, mild loss sort of person.
I mean, it seems like a true multitasking device. I mean, I use my AirPods to stream music. It seems like every day, talk on the phone. It seemed to be an easy workaround to turn it into an amplification device to use it situationally.
Yeah, definitely. I think, most AirPods users, bought them for just that sort of purpose, listening to music, listening to podcasts or, taking phone calls and being able to have that, multifunctionality and it's seamless. You've always got it on you. You don't actually have to think about it. I think that's the real appeal there of, having these, assistive features, which you probably don't use all that often, but when you do need them, they're right there with you.
Right. And since you're at NAL, the home of the, I think the very well-known, very well-respected NAL gain prescription targets, can you tell us a little bit about how the gain of the AirPods Pro might compare to prescription hearing aids when trying to match NAL targets?
Yeah, so I think as soon as the headphone accommodations was announced, my first thought was, well, what prescription are they using? So, pretty soon, we got them in the lab and started taking some measurements. We wanted to see, how do they compare to our NAL NL2? And some interesting results. So what we did is we programmed up a few different hearing loss profiles. So there was a mild sloping loss, a mild moderate loss, a flat loss, and we got them in the lab. Did some acoustic measures with our sort of Hertz or Keymar mannequin, and compared the gains of the headphone accommodations to the real ear insertion gain that is prescribed by our algorithm. And what we found is that at normal speech levels, so around 65 dB, they match pretty closely up to maybe about 5K. They don't have a lot of higher frequency than that gain. But at the loud and the soft speech levels, the match wasn't as good. So they don't have as much compression as we have in NL2. At soft speech levels, it didn't amplify enough compared to NL2, and at loud speech levels, there was too much gain.
So it sounds like they're a little bit more linear than what you might find in a prescription hearing aid, but they do a reasonably good job of matching a mild, high frequency, moderate loss for average level inputs. Do I have that right?
Yeah, that's right. And I mean, we have NAL NL2 was designed to enhance speech intelligibility while keeping the overall level at a comfortable volume, so not having overly loud sounds. Now, Apple may be prioritizing a different aspect. Maybe they're going more for making music sound better and not wanting to lose any quality, or not wanting to have it sound too unappealing to an initial person who's just turned it on for the first time. So yeah, they'll have different priorities on how they've chosen that gain. And I can't really speculate on too much on that.
Oh, fair enough. And I think anybody that has a probe mic system could evaluate that themselves and see how they compare to prescription hearing aids at matching these different targets.
Yep.
So I think it's fair to say that AirPods Pro does a reasonably good job of matching gain for average, for audibility. That's good. How does the performance and background noise of the AirPods Pro compare to prescription hearing aids?
So yeah, we did another lot of measurements looking at the conversation boost feature and the ambient noise reduction feature. So we had target speech coming from the front of the person wearing the AirPods, and then within a horizontal array of loudspeakers. So noise coming from the sides and behind in one scenario, and then one from equally spaced all around the listener. And we found when conversation boost and ambient noise reduction were at their full, turned on and at maximum level, about a 5 to 7 dB improvement in the SNR advantage, just from measured at the ear. This was about between 3 and 5 dB due to the directionality feature, the conversation boost. And this is basically in line with sort of conventional directional microphones and hearing aids. Now, some hearing aids have more sophisticated microphones and processing that can do better than that. But yeah, for a baseline sort of hearing aid, I think we could sort of say they're kind of comparable.
Exactly. No, I think that's kind of interesting for sure. You already mentioned a little bit about people that had normal audiograms or don't have any real hearing loss on the audiogram. And I know that you did a study, at least some of the group at NAL conducted a study using the AirPods Pro on people that had normal audiograms. Can you tell us a little bit about, maybe share some of the highlights of that study?
Yeah, definitely. So that study was led by one of our colleagues, Joaquin Valderrama. We have quite an interest in this particular group population, the normal audiograms, but more than average difficulty hearing and noise. So we thought AirPods Pro could be a good option for them. The study used, let me take a look at some of the results. 17 participants. Self-reported hearing and noise difficulties. There was a range of measures. So we had behavioral speech and noise testing in the laboratory. We also did a 4-week trial with real-world measures where we sent them home with the AirPods that we provided to them and got them to rate their experiences when they were using them in challenging listening situations. So what some of the key findings were that for the speech and noise testing in the lab, there was a sort of a general increase across the participants of 12%, so from 55% correct on a speech and noise test to 67% correct. They rated their overall hearing experience as a bit better than without the AirPods. So there was a slight improvement. It wasn't an overwhelming improvement. So some of the feedback was the amount of hearing benefit wasn't really that much, wasn't that noticeable. In terms of comfort, for some participants, the AirPods Pro just didn't fit well in their ears or were uncomfortable after a short time. And the other one, which was quite interesting, which you kind of think is sort of obvious, but people don't recognize them as hearing devices. So if you're having a conversation with someone and you're using them to hear them better, they have the perception that, perhaps you're not listening, perhaps you're listening to music while you're having a conversation. It's sort of seen as a bit rude. So yeah, they felt they had to, it was fine if they were with family and they knew the purpose of them, but if they were talking to someone that didn't know, they felt they had to always explain, why they've got them in.
Exactly. I have first-hand experience with that problem that you just mentioned. But I think what's really great for clinicians to know about this study is that now they have people that have normal audiograms but self-reported problems in background noise. There's another option out there. I mean, a lot of clinicians know that they've tried hearing aids on folks like that and they don't do very well typically. So now there's another alternative, and I think that's good for everybody that's concerned about people not hearing well in those kind of places. So
yeah, I mean and I will add in that there were, I think it was about 30% of the participants did say that they would continue using them as hearing devices in the future. So even though it wasn't, everyone or a majority, there was, a sizable proportion that did find the value in them. And yeah, I think definitely, if audiologists are recommending them as devices to help people who probably aren't ready for hearing aids or don't have enough loss to want to take that step, then it is a good sort of entry level sort of stepping stone to get into, doing better for your hearing.
Exactly. Now, I wanted to kind of shift gears a little bit. Just in the last month or so, I think it was in Hearing Review, I saw the publication. you had a really nice little study in there that evaluated the noise cancellation characteristics of the second generation AirPods Pro. That's kind of an interesting twist on this device. So can you tell us a little bit about what these features are and how they might help a person?
Yeah, so the AirPods Pro have a active noise cancellation feature. Many people actually without hearing loss do really like this feature and use it a lot. And it may be a purchasing decision for AirPods Pro. But for example, in situations like if you're traveling on a train or a bus or an airplane, definitely, where there's a loud sort of ambient noise around you that is quite constant and consistent, active noise cancellation is a really great feature to really reduce and sometimes even totally get rid of that sound. So it allows you to hear the audio clearer, that you might be listening to a phone call or your music or something on your streamed from your phone. It also reduces that need to turn the volume right up so you can hear well. And that's sort of the angle we were looking at it from here when we see there's a lot of discussion about the use of AirPods and young people listening to loud music and potentially increasing their risk of developing noise-induced hearing loss. So something like that active noise cancellation feature can, potentially reduce that risk.
Yeah, I think that's really good to know. I know there's so many young adults out there that listen at levels that are probably too loud, and it's really important, obviously, that they should protect their hearing. I have one final question for you, kind of maybe a crystal ball kind of a question, and that is, I think I think there's enough. You've assembled enough data to show that pretty clearly that the AirPods Pro is a reasonable substitute for a hearing aid for a lot of different folks out there. Obviously, not for everybody. But I wanted you to maybe think about how the AirPods Pro could be used in the clinic. What's the role of the audiologist in recommending, fitting, fine-tuning them? What are your thoughts on that?
Yeah, I think there's a lot of opportunities for audiologists to fit into this sort of journey, I guess, if they were to recommend AirPods Pro to their clients. So, for example, to best fit the AirPods Pro, you would want an audiogram. There are options where the person can use an app on their phone, but depending on their tech savviness or ability to do that test, we don't know how accurate the results would be. So things like, taking a quality audiogram in the clinic, also setting up the AirPods Pro with that audiogram. If you can see from the Soundbites video, it's not the most, intuitive process. There's quite a few steps involved. You have to be quite invested, I think, to get through that. And then there's the adjustments. There's different slider adjustments that you can do to modify. So maybe you successfully input your audiogram, you listen to it and it doesn't quite sound right. Maybe it's a bit tinny. Maybe you want to boost things up, or the overall sound might be too loud initially. There's adjustments. So just I think walking clients through those features, what they mean, what they do, when you'd want to use it. For example, conversation boost, the directionality feature is one that you manually switch on and off. So I think maybe the average person doesn't know when is the best time to use that, or when, if you're using it in a quiet environment, maybe it's going to affect the sound quality. You don't really want that on. So those sort of things. Also, yeah, as you've said before, the real ear measures to check that amplification and see, is it really doing what it should be doing, and is it sort of a recommended sort of amplification for that person to have?
Right. I see the audiologist kind of the gatekeeper when it comes to what's happening in the ear with their real ear measures. There's no reason you can't do that in an AirPods Pro.
Yeah, definitely. And yeah, just as a trusted source of advice for someone to go to who's concerned. I mean, I have a great respect for audiologists. I have two family members, my husband and my daughter, who were born with hearing loss. So I've been going to hearing clinics and getting, hearing all the hearing advice through that way. So, yeah, I definitely think they can play a role as well with a different population that, maybe doesn't have a strong need for that consistent everyday hearing support.
Exactly. That's great. So any final comments? One, I want to remind all of our viewers that the research, the articles that we mentioned today during the interview will be in a link in the either in the notes from the broadcast or on the screen. You can click on it and find all of the articles that we've talked about today. And with that, Nicky, any final comments, any suggestions for audiologists out there about working with the AirPod Pro? Anything that you want to add that we haven't talked about yet?
And I think generally, my goal in looking at AirPods and publishing the articles about it is really just to inform people of the different options available. Like, I don't see them as a replacement for hearing aid. I think they suit a different type of population and for those situational use cases. But I know there'll be a lot of people out there who, are struggling to hear noise and are not doing anything about it. And perhaps they already have AirPods or some, and it's not just AirPods we're looking at. We also do trials on other hearables, for example, the new hearer, or, we're looking more into the OTC hearing aid space. There are, new options coming available that many people won't know about. So, yeah, the goal here is just to inform, try and let people know, bring that awareness up. And I think having Apple put these features in the AirPods really does raise the awareness of hearing health. People are thinking, oh, what's this? Maybe I'll give it a go. So I see that as a good thing.
And as they say, a rising tide lifts all boats. And I think this is a good example of that, especially when the most of the data that I've seen recently says somewhere between 80 and 85% of people that have hearing trouble are not getting the help that they need. So I think all of us benefit when there's new players on the market that people can have access to. So thanks for all your great work in this area. Dr. Nicky Chong-White, who's a principal engineer at the NAL in Australia. Thanks for being on the broadcast. We really appreciate it.
Yeah, thanks for having me. It's been a great conversation.